licensed and certified speech language pathologist, and welcome back to my channel and to my living room. Thank you guys so much for liking, watching, subscribing to my channel, and also be sure to check out speedyslp.com for tons of free resources for parents as well as for SLPs and for SLPs to give out to parents. Don't forget to sign up for my exclusive email list because we have our February PDF being released very, very soon to those of you who are subscribed. And it is exclusive content just for my email subscribers at speedyslp.com. Okay, so, also don't forget to follow me on Instagram at Speedy Speech and on Facebook at Speedy Speech Path. Okay, so I'm very, very excited to get into this, and I will try to talk as slowly as possible, but you guys know I get very excited. So grab a piece of paper and a pencil and maybe jot a couple of these ideas down. That way you can remember them and they will be easier and you'll understand them better in order to implement them in your home or in your therapy sessions if you're a therapist. Okay, so I got an email from a parent, and this has been a topic that has come up over and over again, and I was thinking, why don't I have a video on this? And then I was like, I could do one today. So here it is. I got a question from a parent that says, my child repeats everything. I don't know how to get them to stop repeating. So the therapist terminology for this is echolalia, and that is where a child just echoes or repeats or parrots. A lot of times parents use that term as well, like parroting, repeats questions and anything back to you. So if you say, how are you? They'll say, how are you? And at first it may come off as great because your child is imitating, and that is definitely a developmental skill that begins with gross motor, fine motor, and then eventually words. The video for that is right here. But it could also be a red flag for autism or another social disorder or a delay. And so although this doesn't mean that your child has autism, so calm down, don't be all upset. It just means that this is one thing, which is an atypical behavior at some age range and point of development. And so this is a sign that goes along with other signs or symptoms or red flags for children with autism. So do not worry, because I'm gonna teach you how I would target this in sessions, and that way you guys can work on this at home with your little one. Okay, so the first way that we're going to decrease echolalia, where your child just repeats everything, is we want to stop asking the WH questions, which are who, what, when, where, why, that parents often ask just in everyday routines because your child is repeating back to you because they don't understand the question. And so the way that we're going to treat this is, number one, by lowering the comprehension level for the question. So if you're saying, well, what do you want for lunch? Bananas or apples, right? Instead, we're going to change the question by saying, did you want apple? And then I'm saying apple. I might say it again. Oh, apple. You could do the little sign for it. You could do a visual cue. And if you need the visual cues, those are also downloadable at speedyslp.com. It's for free. And so instead I would say, do you want apple? Yes. And so I'm modeling yes. And if your child immediately repeats yes, the most important part is that we follow through and we give them the apple immediately. That way they recognize that they said yes and mom handed them apple. Now, would I hand the child this apple? No, because you guys know, if you've watched any other video, that I'm going to take this little apple and I'm going to cut it into 1,000 pieces. So I might use this as the example because a child might recognize this as the apple versus the little tiny pieces that you're going to cut up the apple into biteable pieces. And why do we do that again? Because if you do it this way, you only get one trial, versus if I cut up the apple into 15 pieces, now you get 15 trials and I give them one piece of the apple. So again, do you want apple? And then after I said yes, the second time I'm just gonna model. I look ridiculous, but I'm really gonna like shake my head like yes means yay, right? And so we're being super excited about this apple. Want apple? Do you want apple? And I'm gonna hold. And what I'm waiting for is to see if the child independently produces yes. Once they do, we're ready to move on to no. Sometimes I'll even give them a little prompt of my lips. So I'll be like, kind of like I'm saying the word without actually verbally saying that, because that can also be a visual cue. Okay, and so after that, we're gonna teach them no. How are you gonna teach them no? with an onion or something that your child does not like, okay? And so I want you to get something very gross. So a lot of times I'll do like a texture item that's small that children really don't like. And you're like, you guys are so mean. No, it is a behavioral approach though, because I really want the child to really not want whatever it is. Otherwise, it's kind of a moot point if I'm asking them if they do or don't want the book, because they don't really care, right? And so I have a spinach leaf and some olive oil, and a lot of times I'll put a bunch of these on a plate, just dipped in the olive oil, like something gross like that, and then say, after you've done your apple, right, the next one is, did you want leaf? And then I will exaggerate, no, ew, ew, yuck, ugh, right? And I'm being really exaggerative and I'm saying no, and after I do it a couple of times, then I'm gonna take away the verbal cue so that they're not just repeating after me. So, do you want leaf? And I'm giving them, and if they ever are nodding their head yes, it is so important. That is the importance of the yes, no question, because it's already at a lower level, and that way there's only 2 answer choices and they are provided visually here with the nodding of the head. And so if your child is shaking their head yes or saying yes whenever you're verbally offering first, yes or no, you need to give it to them, because I want the child to be like, like, no, because eventually what I'm looking for is, do you want leaf? Even if your child just pauses, that is a win, because they didn't repeat after you, okay? So what I'm looking for is a pause. Whenever kids are starting to like process, like, wait a second, she's gonna hand me this leaf again, I usually see a long pause, like, and then they're unaware of what to say, so then I'll give them that visual cue. And if they imitate no, even without the word, if they imitate with their head shaking, that is a win. And I say, okay, and I put it down, and then I'm gonna do the trial again. And then maybe we'll switch it up with the apple, because all I'm looking for is that they recognize what the word no means in that context. So your child might say no to other things, but what we're looking for here is, do they understand the answer to the yes and no question based on their preferred wants and needs? Okay, so that is the first way that we are going to help decrease echolalia, and it is a long road. It's not just going to happen overnight, so make sure that you give yourself a pat on the back and a glass of wine and new nails or something, whatever you can reward yourself with, because I would set up a schedule where you practice this 1 time a day, every day for 5 days for 10 minutes, right? With a really highly preferred object and a really non-preferred object, like something that the child does not want. It's important to not use a book or something that your child could care less about, like, which pillow do you want? And so that is going to be the second way that we're going to treat echolalia. And so the second way that we're going to treat echolalia is by once your child has mastered yes and no, we are going to the WH question level, but we are using 1 non-preferred object. So we're just bumping this up from yes, no to the WH question. So like, what do you want to eat? Did you want, and again, I could use apple, or I have banana, and you can do like the sign for banana if you want. And so you could do banana or onion. But the important part of this is always offer the preferred object first. And this is after your child has mastered yes and no. So banana would be the preferred object because nobody wants an onion, right? And that is important because if they're imitating or if they're being echolalic, they're just going to repeat whatever the last option is. And then you say, okay, and you give them the onion. That's why it's important to do this. So if your child, so let's say like in the email that I got, the mom said she's offering, did you want chicken fingers or mac and cheese? And the child is saying chicken fingers, mac and cheese. I would make both of those since you already offered that, but I'm saying don't offer that anymore. Offer 1 preferred, 1 non-preferred. But if it's already too late and you've already offered both preferred, then make both of them. And then what we're gonna do is after, we're going to make a fill in the blank statement. So we're gonna turn it into a statement. So I'm gonna say, I want chicken fingers, and then give the child the chicken finger. And then you're gonna say, you're gonna point to the macaroni, see if they'll come up with it. And then you can say, mac and cheese. You can give them a little hand cue. You can do your or your can, whatever it is. And again, those are all Speedy Speech hand cues, and be on the lookout for another video that's coming out with all of those hand cues used at one time. Okay, but anyways, we're going to make sure to fill in the blank with whatever it is that you're giving the child. So you could do chicken 3 times in a row, and then you could give macaroni 3 times in a row. So what we're doing here is we're drawing the correlation between the object and the word. So over and over again, instead of doing both, and that's the importance of offering one preferred and one non-preferred, because if we're always offering both preferred objects and your child doesn't really care. So what we've done here is raise motivation by throwing in an onion or something gross that your child doesn't want. And that way they're more likely to stop and think like, okay, I really want this one. Like, how do I say that? You could even say, show me. They touch the chicken and then you feed them that word, chicken finger or chicken or nana, whatever it is that your child wants. You're feeding them the one word. And that is the importance here, is that they're starting to do fill in the blank with the preferred objects, because they've already been through preferred and non-preferred, and then even back to the first step with, do you want the onion? Yes, no. And you want them to understand the question and model no for you. So those are my top 3 tips or tricks for treating echolalia. You could do this at home, but remember, it is a marathon, not a sprint. It won't happen overnight. But again, we really want to make sure that your child is meeting those developmental milestones. And so if they have skipped a phase of the developmental milestones, then make sure you go back and make sure that they have great attention, that they're using gestures to communicate. A lot of kids are going to be late talkers because they've skipped using gestures, which is a huge pre-linguistic skill. So we can start and we can back up with the gestures, as in come here, or my turn, or go, or up, or bye. And you can start using signs or gestures, whatever is fun and works with your child. So we want to just fill in the blank if your child has skipped a couple of those and made it all the way up to echolalia, because now we recognize that they are actually not comprehending what they're able to say. And we need to back up and make sure that they are going to be able to comprehend what they're saying. And we start that with attention and all of those other skills that I've gone over. So make sure to check out my other videos if you need any questions. And don't forget to play with your child at home, because that is the most important thing that you can do at home. So set your timer, make sure to reward yourself, make playtime fun, don't force them to do anything. Do a lot of running around activities. Gross and fine motor skills go great with speech and language development, because studies have shown us that they are able to incorporate the information and understand and process the information quicker whenever their little bodies are moving. Okay, guys, so that wraps it up for today. Hope this was helpful for you and your little one working on reducing echolalia at home. See you next time.